I'm joined now by Dr. Ranjan Sudan, who is talking about SSAT's session on advances in endoscopic surgical intervention. So can you talk to me about some of the key points that you'll cover?
Certainly. DDW, as you know, brings about an amalgamation of both experts in surgery as well as in endoscopy and GI medicine. And we've taken this opportunity to bring two experts from the surgery side and two from the endoscopy side to talk about advances in surgical endoscopy as well as GI endoscopy. So some of the things that are happening these days is there are advances in bariatric surgery, and a lot of endoluminal techniques are being promoted in bariatric surgery. So we have Dr. Bipin Chand, who's going to be talking about suturing endoscopically and various other endoscopic techniques, including providing access endoscopically for feeding tube purposes. There are also many complications that occur as a result of bariatric surgery, and Dr. Bipin Chand is going to be addressing how to manage these complications endoscopically. With regards to upper endoscopy, Dr. Kevin McGrath is going to be talking about advanced techniques for imaging Barrett's esophagus. These are techniques that are not necessarily very familiar to the surgeons. They're more familiar to the GI endoscopists. So the GI surgeons who will be attending this meeting will learn about advanced imaging modalities. GI surgeons, as you know, are starting to become more sophisticated with upper endoscopy, primarily because of bariatrics. And in that sense, they will run across people or patients who have Barrett's esophagus. So they need to be aware of these advanced imaging modalities so they can bring state-of-the-art imaging techniques to their patients. In addition to that, Dr. McGrath is going to be talking about endoscopic ultrasound, and again, this is not something that is very familiar to the GI surgeons. So I think the GI surgeons have a lot to learn from the endoscopic experts who are going to be presenting on this panel.
And this added knowledge is really going to help them treat their patients and really move the field forward.
Absolutely, absolutely, because I think they are now familiar with managing the scope and learning basic techniques. This takes the field a step forward into more advanced techniques.
And you're not just talking about it in this session, this is a real show and tell.
This is a show and tell session that will actually reside on the SSAT website as well subsequently, and it'll be available also through the DDW.
That's great, because then people can see it and rewatch and then learn more in depth.
Yes. Also, Dr. Dan Wild will be talking about advanced endoscopic techniques for the small bowel. So there have been some recent advances such as double balloon endoscopy as well as spirocenteroscopy that allows our patients to actually, even the gastric bypass patients for instance, to get ERCP that otherwise would not be accessible unless you actually operated on these patients. So I think these techniques that the GI doctors are going to be presenting will be of great value to the surgeons.
There's a learning curve, but it sounds like it will be very empowering as well to be able to offer new options to patients.
Absolutely, because many of us are not necessarily aware that these options exist, and hearing about these options and actually seeing them and how they might be applicable to our patients will certainly empower us to be able to treat our patients with more minimally invasive techniques.
What is the goal that you want attendees to walk away with after being at this session?
I think we want to be able to be sure that they are aware of these techniques. Certainly we'd like them to learn them and apply them in their practice, but even if they know when to refer appropriately to the expert, that would be a good goal to have.
They're helping the doctors and the patients.
Absolutely.
Thank you so much.
You're very welcome.